I'm a midwife. I've worked for 13 years at Nottingham City Hospital. I'm currently based on Labour Suite. I'm also a full-time PhD student, so I'm just coming to the end of a 3-year doctoral training fellowship.
Why are you, as a midwife, doing a PhD in research?
I think midwives are the best people to do research about the midwifery profession and about midwifery care. As a clinical research, I have direct access to knowing where services need to be improved and developed. And I also have access to women's views about their wants and needs for the service and things that they'd like to see developed with the service.
Do you think midwives should be researchers?
No, I don't think. If that's not their career path, that's absolutely fine. But I think midwives need to have a knowledge of research. They need to be able to evaluate and interpret the findings to ensure that their practice is based on the best possible evidence.
What is your research question?
My research question is, how can midwives support women who have symptoms of anxiety in pregnancy?
What led you to your research question?
So I was inspired by the women that I've cared for, really. When I was working on the transitional care ward, I was interested in fetal growth. So I looked at that for my master's and found out that anxiety in pregnancy was associated with poor fetal growth. So I got interested in anxiety. And then on Labour Suite, I've cared for women who are really anxious about labour and birth, and started to think, well, how can we as midwives intervene earlier to help them with that, to improve their symptoms and also possibly improve health outcomes.
What is your chosen paradigm and why did you choose it?
I think when you talk about paradigms, it can be enough to put people off research. But just simple to say, really, that as a midwife we believe in holistic care, so looking at people's social, psychological and physical health. And my research is underpinned by something called critical realism that also acknowledges that we need to understand events through all of those fields, through a physical, social and psychological, to understand why certain events happen and then to be able to address those concerns and improve outcomes.
What is your approach?
Okay, so I wanted to develop an intervention. So I followed the first phase of the Medical Research Council framework for developing complex interventions and used a sequential design. So first I wanted to look at the evidence that was out there about anxiety and what can help women, and then look at the theory underpinning those different approaches, so such as CBT or mindfulness, relaxation, and then started to develop an intervention, refine that through talking to service users, managers and professionals, and then conducted a small-scale feasibility study, so a small test of the intervention, and reported back on that.
What is your methodology? Okay,
so to test this intervention, I used both qualitative and quantitative methods. So things such as psychometric anxiety scores, and also I wanted women's feedback because I wanted to know how feasible it was to introduce an intervention into practice, and also how acceptable it was for women. So I used qualitative and quantitative methods.
What is your method?
So I used a variety of methods. I first conducted a systematic review and meta-analysis looking at the effectiveness of interventions that had been reported, and then looked at developing that intervention. I used the quantitative methods, as I've said, the anxiety forms, looking at demographics, looking at the number of women who agreed to participate. And also I used semi-structured interviews, so asking women and midwives about their experiences of participating in the intervention.
How will you analyse your results?
Because it's just a small-scale feasibility study, I'm not using the quantitative data to make any inferences about the effectiveness. just simple descriptive statistics to help build on that research. So the numbers of women who were eligible and who participated and their scores before and after the intervention. And for the interview data, I've used template analysis, and that's a qualitative analysis that allows you to develop and refine themes that emerge from the data, but also to interrogate the data for things that you feel are important that have been informed from the literature. So I'm currently analysing the results and writing up the findings and the implications for practice and for future research.